Hello, everybody. Welcome, welcome, welcome. Hello, hello. Thank you all for joining us today. I hope everyone is having good evening. Good evening. I hope everyone's having a good day. We have an amazing OBGYN that we will be talking to today. So I am hella excited. Hello. Let me know if you guys can't hear me or if anything wonky is going on with the visuals, so I can fix that. All right, let's see if we can add. Let's see if we can add Dr. Sink. Give me one moment. Welcome, everyone. Welcome, welcome. Glad everyone can be here today. All right, let's see if we can get Dr. Sink in here. Might have to wait for Dr. Sink to join us before I can send the message out. Please feel free to ask any questions you guys might have in the comment section. I see Village Doctor or hashtag D3 is in the comments. D3, can you add our interviewee in the comments for me? Hello, everybody. I'm excited to have an amazing conversation today with an amazing, oh, here she is, an amazing OBGYN. Let's see if this is going to work. Hi.
Hey.
How are you?
Good. How are you?
I'm good. I'm so excited for our conversation today. You don't even understand.
Me too.
Okay, let me make sure. And if you all in the comments, if you all can't hear us or if anything is going crazy with tech, just put it in the comments and we'll try and go from there. How are you?
I'm good. I'm post-call, so got my doctor fit
Listen,
on. Threw a little
I
eyebrow on for
literally
you.
I have where I literally am just coming in 30 minutes ago from work.
I
So
understand, girl.
we're on the same energy.
Yeah.
Okay, so without further ado, let's get started. Do you wanna introduce yourself to everyone?
Sure.
I think let's do that. And then I
Okay.
can follow up with the accolades that we have.
All right. So my name is Dr. Mariah Sankey-Thomas. I recently got married in October. And I am currently a OBGYN resident in Houston, Texas. I am in my third year out of 4. Praise the Lord. Almost done.
That's good. Yes, congratulations. I
Thank
was gonna get to the recent nuptials later on.
I'm sorry. It's okay.
Um,
You know, we still
no,
excited. Still in the
no, you're
first year.
fine. I'm excited for you. I'm so excited for you. That's awesome. Like I said, later on, I was just gonna touch on. I wanted you to talk to us about like just being a married woman in this medical field and what that means and how exciting it is for you and like what all that meant. But in any event, we'll get there. So I just want to, for everyone that's tuned in, I just want to make sure you all know that Dr. Sankey. So do they call you Dr. Sankey or Dr. Sankey-Thomas?
Still Dr. Sankey. It's a little mouthful.
Okay.
Yeah.
Okay. Whatever you want is what we will call you.
You can call me Dr. Sankey. It's fine. Or Mariah,
Okay.
honestly.
Okay, Mariah. Okay, so I just want everyone to know that you are a Howard alum. You are you a member of the Divine Nine?
Yes, I am a
I thought so.
Delta, a member of
I
Delta
thought
Sigma
so.
Theta Tauri
Hmm.
Incorporated.
And
Plus Alpha
and
Kappa.
remind us again, remind us again where you are going to or where you graduated med school from.
I graduated from the University of South Alabama College of Medicine in Mobile, Alabama.
Hello.
Yes,
Round of
from
applause for that.
Alabama. Went
We
back
love it. We love
home.
it.
Yes.
Now, where are you originally from?
Opelika, Alabama, a very small
Oh.
town right next to Auburn, Alabama. We're like basically the same city. If people know, like Auburn University and Cam Newton from back in the day. But grew up there, born and raised, and have three siblings. Went to Howard, 13 hours away from college. I had to get out, and now I'm
It's
back
okay.
in the South.
So, I also went to Howard. Bison, HU,
You know, you know.
Didn't graduate from there, but
Okay,
hello.
we still claim you. It's okay.
Thank you. Thank you. So what took you from Alabama to Howard?
Honestly, so my family is really, really HBCU focused. Like all of my siblings went to historically Black colleges.
Hmm.
My eldest brother's an entrepreneur, so he owns multiple businesses. My second oldest brother went to Alabama A&M, and then he graduated from law school here in Houston at Thurgood Marshall Law School, which is also a Black law school. My sister went to Xavier. My dad went to Tuskegee. My aunt went to Spelman. Like, we're just all
It made
South
sense.
Carolina State, all over in our. So I knew I had to go to HBCU, honestly.
Yes.
And so I knew I wanted to go to a bigger one, and I wanted to
Mhm.
go to the best one. And so,
Come on.
of course, that was Howard.
Yeah.
And I wanted to experience a bigger city. I've always thought that I've been like kind of a country girl, but like I like kind of city living, whether it's in DC, New York, Houston, Atlanta.
Mhm.
So I ended up getting a scholarship there because my mom and dad were like, "You're not going all the way up there without a scholarship," which I
Yep.
understand. Private school is expensive,
Yes. Yes.
but I got a scholarship there, and my mom took me up there thinking I was gonna hate it, gonna be cold, gonna be scared, and I was like, "Oh, I love it. Sign me up." Got it line.
That's hilarious. But then came back home for med school.
Yes, I actually did
Okay.
a program at my med school called the Dream Program back then, where it was like you applied after your first year of undergrad, and
Mhm.
then after you did a summer program after your first and second years of undergrad at the school, where you just did like intense like chemistry, biochem, like
Mm.
biology, sociology courses, MCAT prep. And then if you made certain scores on your MCAT, if you did make certain GPAs, I had an automatic seat in my med school. And so that's how I ended up back in Alabama. And honestly, my dad is the one who found that program for me. And he like made me apply because I was like, I don't want to go to Alabama for a summer. Like, I want to stay in DC with my friends. And so
Right.
like,
Right.
I always say I probably wouldn't have been a doctor if my dad hadn't have like been like, Mariah, you're going to
Oh,
this program.
wow.
Yes, because that's how I got my automatic seat into med school. And so I tell all pre-med students and like anyone who knows people want to go into medicine, look for those programs because you can get it, through just applying regularly, but it's nothing to already have a seat once you're in
Yep.
undergrad. Like it takes a
Yep.
lot of stress off your back.
Yes, ma'am. We always hate to give our parents credit
Yeah.
publicly, but
You
Let's
got
give them
to,
right. You have to give them credit where it's due.
Exactly.
Okay, so that was actually going to be one of my first questions, just starting with med school, talking about the transition from undergrad to med school. What was one of the difficulties that you might have faced?
One of the big difficulties is that I went from Howard, Washington, D.C., very diverse city, very black school, to
Talk
back
about it.
home in Alabama, Mobile, Alabama, also a diverse city, but it's a little bit different. And then my med school, which is of course a majority white med school, where it was, I think, we actually had a high percentage compared to other classes, where out of 75, it was 11 of us that were black. Yeah.
Um,
And so in our class, and so it was just really learning, um, how to vibe in that different
navigate.
environment,
Yeah,
and thrive in an environment where you aren't seeing people who look like you all the time in the
yeah,
positions that you want to be in, and having to adjust in that way, find your community, and then don't get me started on the like knowledge, like it's the way that they say it, and you probably know, is once you go from college to med school, it's like drinking out of a water fountain to trying to drink out of a fire hose that just
a fire hose.
keeps
Yep,
going, and you can't catch your breath, you can't get it
yep.
all, it's impossible, you just have to try to get as much as you can and get the best parts that you can.
I
And
know.
that
Yeah,
was very, very big change for
yeah,
me, because I was like, oh, I'm smart, this is easy, like
yep. And then
like
they
I
put you
got
to the
in, it's nothing.
test.
I can study the night before the test. No, that was not medical school.
No.
Not at all. Sun up to sundown in the
Yeah,
library, like
yeah,
turning your phone
yeah.
off, having breaks to just cut it on and talk to your parents like I'm alive. So that
Right.
was
That
really.
discipline.
Hmm.
Yes, 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 yes. Okay, so looking back, if you could give yourself any advice in med school,
Hmm.
what would it be?
I would tell myself that you deserved your position, you earned your
Mm.
position, that you are as
Whew.
qualified as every peer that is next to you,
Mhm.
and that if you were to look back, and I don't know how many years I've been at medical school, like almost 7 to 8 years ago, you would not imagine the place that you are in right now. So just keep going, keep pushing, and you got it.
Can we get a round of applause in the chat for that? Because that was really awesome. I mean,
Hey, Bria.
yes, that was that was your advice to old you, but I mean that advice is just so pertinent to us now. I mean, as the village doctors, we're still in the process of, going through our journey to get where you are now. And I mean, that's, yes, round of applause in the chat. That, that was necessary. That
Yeah.
was necessary. So thank you for saying that. Thank you for saying that. Um, okay. Can you talk to us a little bit about your transition from med school to residency?
Yeah, yeah. It was also another big shock, also a crazy steep learning curve.
Yeah.
But it's so much fun. So when you're in med
That's
school, the first
awesome.
2 years are usually, didactics. You're doing literally all of your college career in like 2 months, the first 2 months of med school, of like whatever your degree was, biology, biochem, you literally do that all over again, your first few months. And then
Mhm.
learn about all the systems and things. And then third and fourth year, you do your clinicals, which is like, okay, now I kind of see what I might be getting myself into. Now I
Yeah.
understand why I wanted to do this again after
Hmm.
all these years. And then fourth year is what I call fourth year best year. Like, you know what you want to do, especially after match day. Interview season is great. I'm so sorry to my COVID doctors and med students, because the virtual interviews and not being able to go on your like interview trips was really, really sucky. We missed y'all. But it's the best year. But then once you go to residency, it is when you start making a check. So I'll talk about the really good things first. You start making a check.
Yeah.
And that is a big difference. Like, it's like,
That's
okay,
a big
finally I'm
deal.
getting paid for this and not paying you to let me do this.
Hello,
Um,
free work, free labor.
exactly. Um, And then, you know, if you stay at your same school, that's fine. I ended up coming to Houston from Alabama. I matched in my #1 spot. I got to come where my then boyfriend, now husband, was from, and we were planning to meet here for my long distance relationship. So that was awesome. And then you get to meet all these different people, different specialties, your classmates, all of that.
Yeah.
So learn from different people is what I really enjoy, going to a different program from my med school. I'm learning from a totally different group of people.
That's
Then you
awesome.
get into just the work. I don't think anything can prepare you for residency, honestly.
Mhm.
You can try your best. You can read as much as you can. Of course, you need to be knowledgeable about your specialty, but it is just different. And you don't know until you're in it and you're in the thick of it. And
Oh my
so
God.
the work hours, they're long, they're hard, they're rewarding, yes, but they're hard. You know, you are taking call. Like in my program, we take 2 calls a month, and so then you hopefully usually have 2 weekends off. And so really learning, you already sacrificed a lot in med school, and that honestly it doesn't stop once you become a resident. But then you just have to continue to know that your goal, attending life, maybe private life, fellowship, whatever is in the future. But that was a big difference. You used to go into class, you're going and saying, "Hi, do you need anything else from me?" And you get sent home
Yeah.
early
Yeah.
from
Yeah.
your
So you're
residence.
saying no more getting sent home early?
No, ma'am.
Oh
No, ma'am.
wow. Oh wow.
You are there to the end. These are your patients. It's your job. It's
Wow.
your yes, exactly, exactly. And so that was a difference. But it's awesome because I'm doing what I love to do. I always, for the most part, knew I wanted to be a OBGYN. And so now I'm in it. Is it hard sometimes? Yes. But do I go home every day knowing that I helped someone? Yes. That I probably
Yeah.
changed someone's life? Yes. Do I feel fulfilled? Yes. All in between the
Oh
struggles.
wow.
Yeah.
That's so awesome. I have some more questions here, but I just want to touch on the fact that you said you always knew you wanted to be an OBGYN.
Mm-hmm.
And I saw on one of your posts, you mentioned I'm doing what I always wanted to do. And that's so awesome. And not everyone gets to say that.
Yeah.
So kudos to you. And we love that for you. It's very inspiring. And
Yes.
yeah, that's just what we want. We all want to be doing,
Mm-hmm.
what we feel like we've always wanted to do. Actually, talking about that, were there any other residencies that you considered while in school?
Yeah, actually, yeah. So, in the beginning, when I started my clinical's 3rd year, I thought I wanted to do either pediatrics because I love kids and babies.
Kids.
I quickly
Hmm.
realized that I like kids and babies that I can give back. I
Yep.
like people that can talk to me and tell me what's wrong with them, why they're crying,
Yep.
and also parents are a whole nother thing that you have to deal with. So it's
You would
kudos
never
to
think
all the
about that.
pediatricians out there. You got it. Because I know I'm gonna be a helicopter mom. I would not want to have to deal with me in the
Mhm.
clinic. Then I also thought family medicine was one I really, really considered because in family medicine you can still do obstetrics. You
Mhm.
can do an OB fellowship. And I just really, really loved that rotation I was on. I love the people. I love the community that I was working for. But my very first rotation was general surgery, and I loved it. I loved the OR. They let me close skin for the first time, and I thought I was the baddest thing across.
Hello.
I said, I got this so cute. I can do it. But I didn't want to do general surgery. I knew I didn't want to have to deal with quite so long surgeries. I'm so sorry. I did not really want to have to deal with men. Working with men, love you guys, love my husband, love my dad, brothers, everyone. It's just a different lifestyle working with men.
It's different.
It
It's different.
is. It is. And then I went to OBGYN and I was like, these women are bosses. They are delivering babies. We are doing hysterectomies. We are the gynocs are doing their own surgeries, doing their own chemo. I
Yeah.
was like, this is the baddest specialty out here. Okay, this is it. I
It fits
delivered my
you.
first baby as a 2nd year med student. And I was the resident was like, hey, you want to deliver a baby? I'm like, I'm a 2nd year medical student, right? I don't even know how to no. And she
Yeah.
was like, yeah, come on. I delivered the baby, and the mom's like, thank you so much, thank you. And I'm like, no, thank you. Thank you. She has no idea that I'm delivering the baby for the first time. This is the best moment of my life and her life.
Wow, that's really awesome. That's really cool. We
Yes.
love it. We love it. That's an awesome story. And it's those moments, like those defining moments,
Hmm.
you know? Wow, that's
It
exciting
really
that you got
is.
to experience that.
I know, and I've never looked back since.
That's awesome. Someone in the chat asked about your scrub hat, and I was looking at it, and they want to know where you where you
It's
got it
from a
from.
place called at Scrub Caps Designs. She was in here earlier. She put like a
Yes,
bookmark.
we want to be cool like you.
If you scroll up, I'm an unofficial probably ambassador for her. But yes, we're living our Drake lifestyles, our certified lover
We
boy.
love it. That is funny. Okay, so can you describe the role of an OBGYN and how it might be, other than the obvious, how it might be different from other roles?
Other specialties and things like that.
Yeah,
Yeah. So for obstetrics and gynecology, of course, we are one specialty, but you can divide us in two separate ones,
yeah,
the obstetric side and the gynecology side. On the obstetric side, of course, that's your doctors who deliver babies. And also on that side, you also have like your infertility doctors who kind of help people with like in vitro, your REI, endocrine doctors, things like that. You also have your high risk doctors once you go into like specialties. That's your maternal fetal medicine who deal with all the high risk pregnancies. So if you have any like comorbidity like really bad hypertension, really bad uncontrollable diabetes, seizure disorders, things that a generalist, which is someone who has not specialized after fellowship, after residency, just needs a little bit of help with. High risk maternal fetal medicine doctors help deal with that. And then
gotcha.
and of course, then that's the people that you see in clinic. You go get your well woman exams done, and then they handle like your care. And then on the gynecology side, of course, that is your people who also you see in clinic for well woman exams. They do your surgery, so your hysterectomies, tying your tubes, doing cysts. You have your gynecology oncology, which is the cancer doctors for like any type
Yeah,
of cancer that deals with your like female organs. So
female organ. Yeah,
yeah, cervical cancer, uterine cancer, so like endometrial cancer, ovarian cancer, things like that. But a generalist is someone who does OB and GYN. And so they did their 4 years of residency. They went out into practice and they deliver babies and they do like certain GYN surgeries, hysterectomies, tying tubes, things like that. And then you have the fellowships that are on top of that. And so the fellowships for OBGYN are maternal fetal medicine, which is the high risk doctors I described. That's a 3-year fellowship. You have your REI, which is your reproductive, endocrine, and infertility fellowship, which is also 3 years. You have your gynecology oncology, which is the cancer doctor fellowship, which that fellowship can be up to 4 years at some places or 3 years. And then you have your minimally invasive gynecology surgery fellowship, which is a relatively new fellowship, and that's 2 years. I think, and then you have your urogynecology, and so that's people who do like pelvic organ prolapse, incontinence surgeries, things like that, which is also 3 years. So like OBGYN is such a vast specialty. Like
yeah,
you can do everything, or you can focus into one thing, and apart from other specialties, one thing that is amazing about us is that we do clinic and we do surgery. So like we see you in the clinic, we do your well woman exam, we take care of you all of your pregnancy, and then we see you in the hospital where you're
you're gonna
delivering
see
your
you in
baby,
the hospital. Yeah,
your C-section, where you're doing your hysterectomy. And so that's a little bit different from general surgeons who don't have all of the like clinic and continuity of care that we have. Um, and I think that our specialty is just special because we literally do medicine, we do surgery, we do everything.
yeah,
So it's really nothing like nowhere that you can't get something probably in our specialty. That's why it's
yeah.
awesome.
It's a daunting specialty. It's my hat's off to you. I mean, you're obviously, built for this. I mean, you are an amazing person. I mean, your knowledge, you, as you said, you've always wanted to do this and it shows. I mean, I keep saying that because it does show. I mean, it's very daunting, and your description of it just kind of proves that like not everyone can do this. So,
You're right.
you
You're
know,
right.
Yeah, so kudos to you for that. Um, what are some common misconceptions or stereotypes that you've heard about your specialty?
Oh, yeah.
Where do we begin?
Because OBGYNs are historically like notoriously known for being B words, BITCHs. Um, and I say that because I think it's because we're a specialty that is now more so female like driven compared to in the past where it was more male driven. We are surgeons, and so we are very like, not to say other specialties aren't, but like, very serious, particular about
Mhm.
crafts. Like when we go into the OR, we're dealing with someone's life. And
Yeah,
so I think that we have a stereotype of being difficult or being a little bit more stern, but because we're women compared to general surgeons, who are most, a lot of more male
yeah,
driven. And so I have not seen that to be the case at all. I have loved every single OBGYN. Like when I was in med school, I loved the OBGYN residents here. I love my co-residents. I love my attendings. And so that's one stereotype. And then that's something that happens more so in like in the medical field, like amongst like physicians and doctor or nurses and like, people who are in medicine. And then I'm sorry, I hear my family saying, hey,
I
sis.
know, no,
Hey.
it's okay. I love it in the comments. I was gonna tell
um,
you about some people that messaged you later, but yeah, I love
yes.
it. I love it in the comments.
Um, and then on the other side for OBGYN, it's our stereotype within the community now. Of course, we know about the increased morbidity, mortality of Black women that has recently been found like 3 times more higher than compared to our white counterparts. There's a big push now more for, doulas and midwives
Yeah.
and like, home births and things like that. To kind of take back control of your delivery, your labor, your experience. And so I hate it. Honestly, I was talking to some of my co-residents about it because I'm like, I went into this because I want to help people. A lot of
Yeah,
people think that I don't want to help them, that I don't
I
want to do the best
know.
thing for them and their baby. But
Yeah,
it's valid. Like their perception is reality. They have seen their experiences from their family members or friends. They've read the news. And so of course people are a little bit more hesitant to trust the medical field at sometimes. And
yeah,
so I'm all for this push. If you want a doula, get your doula, girl. Come on,
yeah,
let's go. We're all advocates for the
yeah,
patient. Midwives were the backbone of our specialty for a long time before it became more physician bound. And midwives still are a really big backbone to our specialties, our mid-level providers, our PAs, our NPs, and things like that. But I just want everyone to know, at least from when it comes to me, I am always doing what's in the best interest of my patients, and I would hope that for the most part of my counterparts, that is also the case. But I understand why a lot of people are a little bit more hesitant now. So I always say, do your research, talk to your doctor who is a specialist, no matter what we want to say, it has gone to school all these years and learned
talk
things.
about it.
And then, also, do your own research as well and come to like a joint decision on what's best for you, your body, and your family.
I love it. I wanted to thank you for talking about that discrepancy between Black women having giving birth compared to our white female counterparts. That is a very important issue. And just kind of piggybacking off of that, as you mentioned, there are so many different problems that we're still kind of working through. Um, what is one that you would like to address just on this platform? What's like your biggest, not necessarily pet peeve, but something that you really wish people would know, or, something that you've always wanted to just tell everybody, in regards to your profession and women and the whole realm of OBGYN. What's
Yeah.
something that you've always wanted to tell them?
I have like a few like high points.
Yeah.
And they're
As
kind of
professionals, we always have stuff that we want to,
yeah, they're
yeah.
very like medicine based and health based. But there are things that I've realized that a lot of women don't know that you would think, and I've realized that once you tell people, it can like save people's lives. And so,
Mhm.
um, One of my big things is for people who are postmenopausal women. And I don't know if this is where you're going, but basically, like, what I want people to know about my specialty is
Yes.
kind
Yes.
of, if you're postmenopausal, meaning you haven't had a cycle for over a year, if you bleed at all, you need to go to the doctor. It's not normal to have a period after you stop having periods, even if it's just spotting, because you need to be checked out for endometrial cancer. I've seen so many people come and they've been like, oh, I've had a period off and on for like 5 years after I stopped. And then they have, cancer because it's a sign of it, and they don't know that that's abnormal. Um, Cervical cancer is totally preventable. We have a vaccine for it now, and everyone's supposed to get pap smears every 3 years when you're 21 to 30, and then you can get it every 5 years after that if they test you for the HPV gene as well. Literally, I love that it's some people's passion. A lot of doctors to like eradicate cervical cancer because there's only so many few cancers that we have like tests for that we
Yep.
can help try to prevent it and catch it in early stages and treat it. And
Yep.
so I hope for a time at some point where no one dies from cervical cancer, like it's all caught early. Birth control is all right, and it is okay. It is okay to plan your next pregnancy. It is okay to try your different options. It's okay to want to do natural family planning, but also just be aware of the very, 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 very high failure rate of that.
Yeah. Very
Unless you're
high.
doing it perfectly. Yes. And
Yeah.
that you have options. You have the pill, you have the patch, you have the implant in the arm, you have the IUD. You have so many different things that you can use. And so I like to talk to my patients about it real early, because we don't recommend having babies too close together. We recommend at least like really minimum 12, but really 18 to 24 months in between babies. So I'm like, let's plan these pregnancies out.
Yeah.
And then always take care of yourself. Well, woman exams, get your STD testing, like always use condoms. Like if you're not in a relationship with a partner that you can seriously trust, get tested regularly. Those are kind of some of my very, very high points where I'm like,
Okay.
do these things.
Yes. Thank you for that. I think it's very important that, we use these platforms and we use this opportunity to kind of share that message. I mean, things like bleeding, postmenopausal. People don't know that, and you really wouldn't know that unless you went to school
Oh,
and
this
were
is
taught.
another thing. I'm sorry.
Hmm. No, you're
Not
fine.
normal to bleed more than like a week for a period. And it's not
Yes.
normal to bleed to the point where you feel lightheaded and dizzy, like you're going to pass out. It's not normal to have two periods in
Blood
a week.
loss.
It's not normal to have debilitating periods where you cannot function. Those are all signs that something is going on. You fibroids, endometriosis, something. So go to the doctor, ask what's going on, get an ultrasound, try birth control, see if it helps, things like that. But try to figure out why your periods are so miserable, or make a doctor or some provider try to help you figure it out, because it's not normal.
No, that's good. That's good. Someone in here said something that I was thinking. Two Healing Hands said, this is why representation matters. As we see more docs that look like us, hopefully the trust will improve. That hit the nail on the head. Again, one of the many reasons why I was very excited to do this interview today
Yes.
was just to see someone that looked like us. I know the importance of having Black female OBGYNs. I mean, she's a superhero low key. Actually, it's high key. You are a superhero high key. And we're
Stop.
honored here at the Village Doctors. We're honored to get this opportunity to talk to you, truly, truly. So I kind of want to pivot a little bit, but I want to talk about the balance, the work-life balance, because it's very important. It's something that we talked about with all of our interviewees. And you do an awesome job. I just want to shout you out for giving us rich auntie goals. I mean, we love to see it.
That is my goal,
You
right
are
now.
giving rich auntie vibes, and we love it. That's
Yes.
what we all want to. We all want to be there.
Those are my babies. My babies I can
Yes.
get back.
When we announced that we were interviewing you, we had I think the most amount of messages coming in from family.
Oh,
So which is it's crazy. So from our personal pages, outside of Village Doctors, and as well as Village Doctors, which was exciting.
Yes,
So just so you know, your familial support is it's broad, it's
yes,
wide, it's
it is.
wide.
They
We
hold
love
it
to
down.
see it. They do that even when you're not looking. They are holding you down.
Yes,
Um, so, and then you talk about body positivity on your page, which is awesome. We know you have a dog. You're a dog mom.
yes,
Yes.
I'm a new
Okay.
dog mom.
There's the excitement right there.
He's
And
bad. He's upstairs, locked out. Look, so he's
oh,
running around hollering.
oh goodness. And recently married.
Yes, yes.
Congratulations. So talk to us about and if there's anything that we missed that
No,
you do.
no,
I'm
no, no.
sure I'm sure you're probably mentoring some people.
Just a few. It's okay.
Just to be and a mentor. It's not easy. It's not
You
easy. Yeah, you
know,
make it look so easy.
gotta back to pull forward.
So talk to us a little bit about what that work-life balance looks like for you.
Yeah, it's it actually is like an ongoing learning process for me. Because it's not something that you like learn easily. Especially because our trajectory becoming doctors is very, very focused. So like you do your undergrad, then you do your medical
Yeah.
school, you focus, you do your residency. And all throughout that you have a lot of sacrifice, like I was saying earlier, that you have to miss things. I've missed weddings, birthdays, I missed homecoming,
Mhm.
that. And so having to now be like married, having a husband, having family nearby, like my brother and sister-in-law, my niece live right like 15 minutes down the road. Having to learn when to leave work at home, which is all the time. Like try to leave as much work at home as you can, finish as much work at the hospital as you can. And when you're off, be off. Like when I'm
Yeah.
off on my weekends, we're going out, we're going on date nights. We're traveling to New Orleans to see my sister. Um, and like learning how to say no both ways. Like, no, I'm sorry, I can't make it to this event because I have this work to do, or because I know I'm going to be exhausted because I'm going to be
Yeah.
having a very hard rotation, which is what
Yeah.
I was last month. And then also saying like, no to work sometimes, like, no, I can't take call that weekend. I have a wedding. Like I'm in a wedding. I
Yeah.
can't and so it's really been a balance, and all of my family, my husband, everyone's been really supportive, and my friends, and like helping me and being with me and learning that it's a balance,
Yeah.
because there's a lot of times I don't answer the phone, I don't text back, I don't call back. I am MIA for days, weeks, because this job is really, really hard, and I'm trying to work
Mhm.
and be a better person at that, which I'm sure you understand.
Completely.
Um, yeah, but it's a learning process, and so you have to have a good support system, like we were saying earlier, who understand that like you don't mean anything by it, you love everyone, like
Exactly.
it's just you're struggling a little bit right now.
No,
And
yeah,
so
you're fine.
I'm getting better at it. I'm getting better at it. But I think it's all just knowing yourself, and then I think our generation is getting a little bit better too about work life balance, where we're
Yeah.
like, no, I need my mental psyche is off. I need a little bit of time, even in medicine where that is frowned upon. We're getting a little bit better.
Mhm. Yeah, I'm excited for our generation to be that bridge that
Mm-hmm.
kind of crosses it over. So yeah, that's good to see, and you're part of that bridge, girl.
I know.
Um, so someone in the comments says, what advice do you have for aspiring Black female physicians?
Oh, yes. My advice is to start early, really. This is for people who know, like people who want to go into medicine, or if you yourself want to go into medicine, start early with connections, doing programs if you can. Like I was saying, doing programs in undergrad that might get you exposure to different medical schools. You do not have to be a science or a STEM major, to get into medical school, but knowing what you need to do, and what, for me, it was like easier for me to be I was a bio major in the beginning, and I switched to sports medicine because I like the track better, but I'm like, for me that was easier, like for me to not have to squeeze in all of the STEM classes
Yeah.
that you have to take pre-med, and to keep going, because I feel like a lot of the times, specifically for Black people who are pre-med, we stop and we give up really, really early. We get defeated by a score or by a pre-med advisor or someone
Mhm.
saying to you. But a lot more people are capable than they think that they are in getting the work done. You just have to do it. You have to get a tutor if you need to. You have to miss the party if you need to study
Yep.
for the test. You have to go to office hours if you have to get it. But I I hate the amount of people who start off pre-med and they're like, oh, I can't do it. Like I
Yeah.
made a B in this one class, a C in this one class, or I'm not smart enough to be a doctor. I'm like, just keep going. Don't let anybody tell you no if you know this is what you want to be and what you want to do. And so connections early. Don't let anybody tell you no. Study, get tutors, do whatever you need to do to get your A, your B. And then summer programs, things like that, to try to get connected into the field early. Yeah, because it's never gonna be wrong to have something in your back pocket where like it's not, unfortunately, who you know is who knows you. So the more exposure you have, the better.
Yes, yes, yes. Okay, we have another question. These are some good questions. How did the pandemic impact you both professionally and personally?
Ooh, that's a good
That's a
question.
really good question.
Ooh,
That
okay.
was really good.
That's
I was gonna ask that, but you know.
no, long story short, okay, because we could talk for days about that. So, professionally in the medical field, um, we never stopped. And
Yep.
so, like, how a lot of people are like, oh, we had the pandemic break, we were all on quarantine, things like that. That never
We
happened
never had that. Yep.
field.
Yep.
If not, we sometimes worked a little bit more
Yeah.
and took up more shifts, especially if you had like a co-resident who was out with COVID, you had to cover their shifts and things like that. And so we continued to work, but then we also didn't have our outlets that we normally had because the country was shut down. Right? So we couldn't go out to the movies. We couldn't go to the bar for happy hour. We couldn't go to restaurants or to the club or anything like that to have fun. And so we were doing the same amount of work, if not more, which is really stressful, but also not being able to have our outlets of those stressors.
Yeah.
And then they're like, you can't hang out together, like because if you have a whole COVID party, your whole program's out.
Period. Yes.
And so you were like really stuck. And then, of course, in the hospital, especially in the OB side, the OBGYN side, one, the PPE, wearing all of that hot stuff, the N95, everything, all day, every day, especially before we knew, like, and we're testing
What
regularly.
was going on? Yeah.
Yeah, operating, like, we used to have to operate in full N95s, masks, like, we would be
Hmm.
sweating in the OR. Um, and then having to see moms deliver by themselves because some hospitals at some point would not let a visitor come in because of
Yeah.
COVID. Or so like fathers are missing their deliveries. Moms are testing positive for COVID and they're taking their babies, away because we did not know what it was. And so
Yeah.
it was very traumatic for a lot of like doctors and a lot of moms and like people who were in the medical
Yeah.
field dealing like with that. And so COVID's not over, even though the country thinks it is. Like, I still know people getting COVID. Like, it's not over, but we're getting it back to us. And so, some normalcy. Still wear your mask, guys. I'm tired of seeing everyone's full face. Um, but
That's amazing.
that was a big difference. It was a lot. It was a lot. And then on the social side, or like on the like my personal side, it was just like stress. Like I wasn't able to see friends, like, or I was scared to go visit people. Like I'm at the hospital all day, every day, so I'm like, I don't want to go see my grandparents. I don't want to go see my parents, and maybe
Yeah.
give them COVID. Go to see all of these people, and so I was like, well, it's just me and my husband, like, and so it was really, really difficult. I would say a lot of people medical field and not had some type of depression, like, or blues at that during that time, maybe still like trying to get out
Dealing
of
with.
it.
Yeah.
Yeah. But yeah, it was rough. And you really had to find your wins where you could, like, and so we would have little parties like ourselves, me and my husband here, or like we had to do a lot of stuff on Zoom because I was getting married around that time. And so, like, we kind of did some Zoom things, didn't know if COVID was going to be over for the wedding, all of that stuff. It was stressful.
Yeah. Oh my goodness. Yeah. Okay. Okay. I'm just gonna get one more comment from the one more question from our comment section. You have a lot of comments coming in here.
I can't
Villagers, if you all, if you all want her back, say the word. We will be more than happy to. Okay, so this question says, what is something that stuck out to you about your residency program that made you rank them?
Oh yeah. Okay. So my program, one is in Houston, and so my husband is from Houston, born and raised, and we were long distance our entire relationship before I matched here, and then he moved back here. And so this was the easiest place for us to meet the distance, and so that was a no brainer. Like I wanted to be in Houston,
Yeah,
or Texas. My program is very diverse, which is not something a lot of programs can say. I looked at my program and I saw multiple people who look like me. And then we have diversity. We have Asians, Hispanics, LGBTQ, Blacks. So like
that's
it's
awesome.
so diverse in my program, and also the attendings were also diverse, and so I really like that. Um, and being in a city where we worked at private hospitals and like a county hospital, so you got the best of both worlds. Like at one of our hospitals, our county hospital, you would be amazed some of the things that we see, and it's sad in the grand scheme of things because
Yeah,
these patients don't have great access to care, so they come to us a lot later in their disease processes. So you have a like stage 4 cancer versus if you had healthcare, maybe we would have got it at a stage 2.
got it.
You know.
Sure. Yeah.
Um, and so experiencing that and then also experiencing the other side of like more private lives, and so I really enjoyed that, and I knew that my program, we learned well, we got trained well surgically, like
Yeah.
we operate day one,
Oh,
efficient of course, but like we I knew I was going to be a great OBGYN, like coming from a program that I applied to, so that's
awesome. That's good. That's good. Um, okay. So we call ourselves the Village Docs
mm-hmm.
because we are all aspiring to be doctors, and we believe it takes a village to achieve any dream. Who would you say is your village, your group of people that helped and supported you along the way, to where you are now?
Oh yeah, it's a lot of people, honestly. My husband, of course, definitely he is my best friend, my partner. I met him, or we were introduced to each other at the end of my first semester of med school, and so he thinks he's like a baby doctor because he's done all of this with me. All medical
He
school.
probably knows some
He
things.
does.
He probably knows some things.
He knows a lot. Trust
That's
me, people are
hilarious.
surprised. My mom, my dad, of course, my parents, like they were the ones that were big on education.
Mhm.
Getting to Howard, pushing me through med school, always supporting me financially. Thank you.
Hello.
Emotionally, and then of course, one big group of people that I could never forget is like my core group of people from med school. It was four of us. It was three black girls, and a one black guy in our class. And we are all thriving now. We kept each other abreast, like in med
Good.
school, like when we were struggling. And then I have my friends, like I have friends, all my bridesmaids, like my friends from when I was younger to my line sisters were people who like legit I would not like just to text, hey, are you okay? Sending you something here and there. And then I had a few mentors I had in med school that I definitely wouldn't have made it here without. And so I think that's important, having people who like look like you. Like my godparents are both doctors, and so I always saw
Oh,
them.
awesome.
And so having people, that's like something that was awesome that I was able to have in my support system. Yeah.
Wow, that's really good. Thank you. So what we're hearing is when you have a nice, healthy, village, then you can become
Yes.
successful like
Yes,
you.
it's all about the village, girl. It's all
Yes,
about
all
the
about the
village,
village.
and you
I
learn
like
that.
that.
You learn that,
Yeah.
especially in med school, because you at least for me, I kind of like would be to myself, like, you're in it so much, and you don't talk to people, you don't tell people how you're doing, so you're struggling and no one knows, and so you feel alone. And it's like, no, you need a village to help you.
Yeah. Thank you so much. I'm so excited to talk to you. This interview was everything I could have hoped for and more.
Yes, it's so good.
Oh my goodness. So to everyone in the comments, everyone that tuned in, thank you so much. Please feel free to follow both of our pages. Stay tuned to the Village Doctors page. We have so much more coming for you all. And yes, thank you. Thank you all so much for coming. And applause. You're getting a lot of applause in the comment
Oh, thank
section.
you.
They love you.
I love this. Thanks, you guys. I enjoyed it. I just want to encourage everyone to strive for your goals, reach them no matter what. No, don't let anyone tell you that you can't do something. And it's never too late to work for your goals. So wear your mask, get boosted. Amen.
We get boosted. Yes. And on that note, everyone have a good day. Thank you, doctor.
Thank you. Bye.